So another little tip when answering NCLEX style questions is to be on the lookout for pertinent information about age or an age group that they might give you. So for instance, if the question takes the time to state something like you're dealing with an older client, the older male, the older female, the infant, the young child, if they take the time to give the age group, chances are that's because the age group is significant to the scenario. It's significant to the question itself, and it's information that you need to answer it. So here are just two quick examples of what I mean by that. This first question says, an older client is admitted with a diagnosis of bacterial pneumonia. The nurse's assessment of the client will most likely reveal which signs and symptoms. And I just abbreviated that just to show you an example. So the question says, an older client. Now going back to what I'm saying, if the question points out an age group, more than likely it's because the age group is significant to what's happening. So you need to keep this information in mind. So we're talking about an older client that's admitted with a diagnosis of bacterial pneumonia, and the nurse's assessment of the client will most likely reveal which signs and symptoms. So I'm looking for something that's specific to the older client in this age group. So leukocytosis and febrile, polycythemia and crackles, pharyngitis and sputum production, confusion and tachycardia. Well, I know that leukocytosis and febrile, crackles, pharyngitis, sputum production, these are all signs and symptoms that I expect to see in a typical bacterial pneumonia. But the question is talking about in an older client. And it's important that we keep in mind that when we talk about the older client population or the geriatric population, they don't present with the same signs and symptoms that the younger or the mid-range aged population will. They actually present with a lot of confusion, disorientation, neuropathies, agitation. We see that often when there's some type of disease process or there's some type of abnormality or pathophysiology that's happening. So with that said, the correct answer here is D, confusion and tachycardia. In states like bacterial infection, and this includes pneumonia, UTIs, any other type of illness of that nature, confusion and tachycardia is typical in the older client. So this is an example of how this makes it important. If it didn't say an older client, and we were just talking about any age, a young client, a 20-year-old client, a 30-year-old client, then these signs and symptoms are what we would expect to see. And in this example, it says the nurse is assessing a 75-year-old male client for symptoms of hyperglycemia. So here goes that age again, 75-year-old male client. Again, they took the time to put it in there. It might be important. What symptom of hyperglycemia is an older adult, here we go, is an older adult most likely to exhibit? So I'm looking for symptoms of hyperglycemia that an older adult is most likely to exhibit. So I have polyuria, polydipsia, weight loss, infection. Well, I know that polyuria, polydipsia, and weight loss, these are all symptoms that I might expect to see in somebody that has hyperglycemia. But this question is very specific to the older adult. Wants to know what might I see in this client? And in this client, infection. Again, you see that these are atypical symptoms and atypical signs that you find in the older adult when there's some type of pathophysiology happening. So that's just a quick example to pay attention to those things. So when it gives you the age group, it's asking you for symptoms, it's asking you to look out for something in the older adult client. Keep in mind that it's probably something that's atypical and specific to that category of client.